Tēnā koutou katoa, ko Hem. It's my pleasure joining at this rehab hot topic session today on achieving equity in rehabilitation. What can I do? So I'm a lecturer at the RTIU. I also work as a pain management physiotherapist at the Wellington Regional Pain Service. So in the next 10 minutes or so, I'm going to take you all for a little journey on equity and perhaps end up with discussing on what can we do about it. Yeah, I think this visual might be quite familiar for most of you, I guess, because the first tile on the left pretty much talks about how everyone, regardless of wherever they are, will get a same opportunity, and that's more an equality-based approach. The middle tile, as you can see, the person with the most disadvantage gets the most amount of support, and that will be the most equitable approach. But I think the third tile, some people would refer that as more as a justice-based approach, where we are removing that whole systemic barrier. And I see the whole health system reform in Aotearoa, New Zealand, which has come into place in July this year, as an opportunity that we can have a health system that would actually work for all. So yeah, we did discuss about what is equity, and the Ministry of Health, the Manatu Hawara website has got some really good resources on health equity. And as you all may know that, yeah, in Aotearoa, New Zealand, any differences in health that are avoidable, but also unfair and unjust, is inequity. And which would mean, as we described in the previous picture, people with different levels of advantage will have different levels of support. And again, from our Tertiary obligations, that means that we should aspire for addressing those inequities for our tangata whenua, but also help them to flourish and lead their own hawara. And equity is quite a multidimensional construct. So we not only talk about from tangata whenua perspective, but also thinking about socioeconomic status and backgrounds, and also by people living in areas by geography, and in terms of specifically for our rural population, and also people with disability, and also gender identity. Yeah, so that's pretty much equity as a social construct. So because I work in pain and also my research interest is in chronic pain, so I'm going to share a bit about the research and some of the clinical work that I've been doing over the last few years. So as some of you or most of you might know, this is the data from the National Health Survey, which gets updated every year. The chronic non-cancer pain, which is pain that exists beyond more than 6 months. And it can be due to from any health conditions. It can be due to low back pain, arthritic pain, or fibromyalgia, or migraines, or chronic pelvic pain. So it's quite an umbrella term, what we talk about when I say persistent pain. And as you can see, pretty much 1 in 5 New Zealanders, and it's been quite the same in the last decade or so. But the prevalence is quite disproportionate for our tangata whenua. As you can see, Māori have 1.4 times at risk of reporting chronic pain, and also people living in areas of high deprivation, and people with self-reported disability. And because in Aotearoa we are an aging population, as you can see, the prevalence and the burden increases as we age. So, and I think that's where this whole Mahi started 5 or 6 years ago, and when I was working, still I'm working in University of Otago, Wellington, and the Takiri Maite Ata Whānau Collective, based in Kokiri Marae. So I had developed the connection with our Maori community partner, Cheryl Davies, who's the manager of the Kokiri Marae. And Otago, Wellington and Kokiri has a long-standing relationship in terms of community research partnership for the last 20 years. And that's where this whole journey of understanding why this burden is disproportionate for our Maori whānau started. So when we spoke to our Kokiri whānau, our Maori participants, the pain experiences was quite different for wahine. For wahine, they often prioritized their whānau and community responsibilities on top of their pain, and therefore help seeking was a challenge. Whereas for Tane, the Maori men, pain was perceived as a sign of weakness, and therefore pain expression and help seeking became a challenge. And therefore, like stoicism came as one of the main themes for both Wahine and Tane living with chronic pain. We also interviewed the Kaya Fina, the Maori community health workers who often work with whānau in the community. They often not only provide health services, but also provide wraparound social services as well. And they are the ones who often act as navigators in terms of taking whānau to hospital appointments or GP appointments. So we asked the Kaya Fina in terms of what their experiences are in terms of supporting whānau living with chronic pain in the community. And what we found was pretty much the primary care was managed through pain medications and nothing else. And whānau took those medications quite diligently, which also included opioids, and therefore they had side effects as a result of that. And what we also learned was there was not much other kind of options in terms of non-pharmacological treatments or explanations of chronic pain. Those were not offered. And also services to any other specialist services, including pain services, was also not offered. And whānau were already taking a lot of Maori traditional treatments like rongoa, which was not even discussed or asked about. And this slide talks about a national audit that was done across tertiary pain services in New Zealand. As you can see here, Māori and Pacifica are quite underrepresented in tertiary services. And I can say that from my clinical experience in the last 2 years in the Wellington Pain Service as well. But when they do present with, to our service, they often present with very severe symptoms and low self-efficacy. So as you can see, like right from pain experiences and also primary care and secondary and tertiary care, the current way of working is or delivering services is not working for Māori, and the way that things are working are actually perpetuating those existing inequities for Māori living with chronic pain. So what can we do about it? And that's when we decided we will ask the experts. So what I mean by experts are the actual whānau who are living with chronic pain, and we ask them what their aspirations are for their pain management. And we acknowledge them that they are the experts, and we are there to listen to them. And this is a visual summary from the hui we had with the Maori participants. And in the middle, as you can see, at the beginning of the project, we were thinking something like an online sort of resource might help, but the participants were very clear. The whānau said kanohi kite kanohi, which means face-to-face. They wanted any service that needs to be delivered in person or face-to-face. And as you can see, whānau were already doing quite a few things in terms of natural remedies and rongoa and miri miri. And also being connected to the nature was quite therapeutic for the Wairua. and also being with similar other whānau and learning and sharing about their experiences in a safe space was something they found really valuable. And from our earlier hui we had, and many whānau reflected that this was their first time they've even been asked about their pain, and that kind of sharing the pain experiences with other whānau was in itself was quite therapeutic for them. And we also gave some creative materials, and we asked whānau to do some we asked them to be creative. And this is an example of one of the creations from one of the Māori whānau. In the middle, as you can see, those colored balls represent different whānau with different pain conditions, but they're all connected together and sharing their experiences in a safe place. And that's something that came up quite strongly, that collectivist nature and the safe place. And that's something they all share, that it's definitely not a hospital setting. So when we went back to the whānau, again, in terms of another follow-up meeting, this is what they clearly said, him, like, we wanted a program pretty much led by Kayafina and held in a community setting, or preferably in a marae, and where they felt quite safe with other whānau living with pain, like a group program. And Kukri was already running several clinics, and whānau asked, like, whether we can have the pain specialist come to the clinic once a month, so that we can have the clinic there. So I think at that stage, you only had funding to ask what they really want, and not necessarily implement what whānau wanted. But luckily, we had the funding from HRC last year, and the initiatives that whānau actually suggested in terms of having a monthly pain clinic and also having a pain support program, pretty much led by the Kayafina, so we were able to run that first program last year. And it also included capacity building some of the nurses who are working in Kokiri Marae, and also the community workers, the Kayafina and the Kaimahi, in terms of how chronic pain is assessed, and some of the pain education tools that we can share as well. So I'll briefly touch upon the whānau pain management program, which we ran last year. And these were some of the tikanga we followed during the program. So it was a 6-week program delivered in a community setting by Cheryl, who's a Māori community partner, and I co-facilitated that over the period of 6 weeks, one session every week. And one of the key things I really want to touch upon was a metaphor that was gifted to us. So this is nata. So nata and is a te reo word for snail, and it's used as a rongoa in traditional treatment for treating some respiratory illnesses. As you can see here, we used the nata, which was gifted to us for this research, to represent the Te Whare Tāpawha model, where Hawara is actually a balance of all these 4 walls of the wharenui, and any imbalance is a sign of illness. And the way we used it in our program is that pain can make the whānau to go within their shell, but the idea of this program is to help them to come out of their shell and still live well with their pain. And we worked with another Māori artist, Izzy, and as you can see, these 6 images became the frame, like the poster images for the 6 sessions. So the idea is, as they went through the 6 weeks, we helped them to come out of their shell and live well and move in the direction that they wanted to go. So here's another example. Like, we used the nata in the sense that we asked whānau to write in the shell part, to ask them things that make them to go within their shell or act as barriers for their pain. And also we asked them to write things which are actually helpful for them in their snail part, which helps them to come out of their shell. And here's an example here. whānau talked about the whakama, the stigma, the shame of being in pain, and the social isolation and disconnect that pain brings to them, and the mamaya, the pain itself as a barrier, and also previous unhelpful racist experiences in the health system, all acted as barriers for their pain management. But they also shared about some of the things that are actually helpful, their whānau, the tinana, the physical stuff, being connected to the nature, the Māori, and the environment, the tayo as well. We used it as a pre-post exercise. We asked whānau to write about this in the first session, where whānau wrote quite a few things in the shell part and not much in the snail part. And we used the same exercise in the sixth session. Even though the things that they wrote in the shell part remain the same, we could actually see the snail part became quite a lot of populated. So that's kind of our pre-post evaluation of the program. So our reflections has been the stronger focus on the whakawhanaungatunga, and not only the building connections, but also establishing and maintaining those connections, and the fact that we acknowledge whānau as their own experts in their pain management, and they were pretty much acted as co-researchers in this whole journey. And we have a little video which captured some of whānau reflections from this program. As you can see, whānau wanted to really change some of the things as a result of the program, and which was great. My widow or challenge is like, what can you do in your practice to influence equity in terms of improving access or enhance the experiences, and also ultimately improve the outcomes, so that we achieve healthy futures or paiora for all New Zealanders. And there are some, as I mentioned before, some really good resources in the Manawatu Hawara Ministry of Health website. Even if you, in the search bar, if you type equity, there are quite a few of these resources, which is quite updated and quite in depth as well. So whichever health system, whichever health background you are, all of these services can help you to take a deeper dive into this construct, I guess. And that's me. Kia ora.